Miswak or toothbrush? Which one really wins for your teeth? The answer may surprise you. Stick around, because I'm going to reveal a simple trick that can make both work better than you ever imagined. Doctor, why do people still use miswak in this modern toothbrush world? Miswak isn't just tradition. It has natural fibers that clean teeth and antibacterial compounds that fight germs. So, it's actually healthy for gums?
Absolutely, but technique is everything. Chewing it the wrong way can do more harm than good. Can kids use it too?
Yes, under supervision. Softening the tips helps prevent gum scratching. And what about modern toothbrushes? Are they really better?
Toothbrushes, especially soft ones, clean teeth evenly. Add fluoride toothpaste, and you protect against cavities.
Is brushing harder better?
No, brushing too hard can wear enamel and hurt gums. Gentle, correct strokes matter more than pressure.
Can miswak replace brushing entirely?
Not really. Miswak cleans well, but it can't give the full fluoride protection that toothpaste does.
So using both is better, right?
Exactly. Miswak is great for quick cleaning or gum massage, toothbrush for thorough cleaning. What about plaque and cavities? Studies show fluoride toothpaste consistently lowers cavities. Miswak alone helps, but not as much.
Doctor, where do most people go wrong with miswak? They chew it quickly or unevenly. I see gum damage and missed areas every week in my clinic.
And toothbrush mistakes? Skipping flossing or brushing too hard. That's more harmful than the tool itself.
Any other common problems you want to highlight?
Yes, using old miswak or worn toothbrushes. Both lose their cleaning power over time.
Any fun facts about miswak?
It's naturally antibacterial. Some compounds in miswak even prevent bad breath. That's why it's been trusted for centuries.
So, what's the correct way to use both?
Use miswak for quick cleaning after meals or when you're out. Brush thoroughly with toothpaste at least twice a day.
Should we brush immediately after meals?
Don't brush immediately after acidic foods. Wait 20 to 30 minutes. This protects enamel.
I see. What about flossing?
Yes, floss daily. Miswak and brushing clean surfaces. Floss cleans between teeth where cavities start.
All right, time for the secret tip.
Most people skip this. Always finish miswak use with a fluoride toothpaste or rinse. It's a small step that greatly reduces cavity.
Wow, that's simple, yet powerful.
Exactly.
Simple habits protect teeth far more than any tool alone. That's amazing, Doctor. What should viewers do next?
Subscribe for more tips and share this video with your friends if they are still confused about miswak or toothbrush.
Your teeth respond to care, not tools. Miswak, toothbrush, floss, all work if used wisely. Start simple, stay consistent, and your smile stays healthy for life. Thank you.